New Mexico Cancer Center and Health Specialist of New Mexico are the proud sponsor of Health and Wellness on New Mexico Living.
The bladder is probably something that most people don't think about because it just sort of tends to do its job. So it's a muscular organ that the kidneys drain into and it fills up with urine. Then when you're ready to go, the muscles contract and people urinate. Most people, I think, if you're younger, don't really think about it because they don't have bladder issues. But as people age, people can have more trouble with their bladder. And, we see this in older folks. And certainly the presence of blood in the urine is a huge red flag that needs to be evaluated. Because it can be sometimes, as I said, easy things like a urinary tract infection or bladder stones, but sometimes it can be the first symptom of a bladder cancer. So bladder cancer is typically diagnosed by doing what's called a cystoscopy. So that's when a urologist looks into the bladder with a little flexible telescope, and we can see the inside of the bladder and see if there's something that looks like a tumor. Bladder cancer can sometimes be picked up by CAT scan or ultrasound that patients might be having for some, different reason. As far as advancements in the treatment of bladder cancer, this is actually a pretty exciting time for those of us that treat bladder cancer. There are many different treatment options that have come out now that were not available to us, say, either 5 or 10 years ago. And I think that patients have newer, maybe less toxic treatments available to them than they did, say, 5 or 10 years ago. I think that the number one risk factor for bladder cancer is smoking. It's certainly not as widely publicized as things like lung cancer or heart disease, but it is the major risk factor for bladder cancer and kidney cancer. And so I think that patients would do better if they wouldn't smoke. If you have a history of smoking and certainly have blood in the urine, you need to get evaluated. Sometimes it can be simple things like just a bladder infection, but the concern for us as urologists is always bladder cancer. We treat all stages of bladder cancer at New Mexico Cancer Center, and we have urologists and medical oncologists and radiation oncologists, and I think that it's important to know that patients have choices and that we will work with you to tailor a treatment that's going to agree with you and your lifestyle.